I had a rough day today. But then I cheered up because I knew that pretty soon we were going to be on Koviki Talk, talking to amazing people. So I love having Koviki Talk on a Monday because it kind of anchors. We all know how Mondays can go. So I am excited to be here today on Koviki Talk, our multi-episode series by Pacific Islanders for Pacific Islanders. So you're only going to see PIs on here
Yeah.
speaking to the PI community. And Koviki means COVID, and that's all we talk about is the different aspects of COVID-19, but through the lens of our own Pacific Islander eyes. And it's all about the vaccine right now.
Right.
And if you want to see a community organization or a group of people, Pacific Islanders, winning, you need look no further than Arkansas.
Mm-hmm.
Because when you think about what right looks like in terms of having the trust of the community and being in touch with the community, these people got it. So let's get into introducing our amazing people we have on the show. Our first guest is Michelle Pedro. Michelle Pedro is a Marshallese American born and raised in Orange County, California. We already traded notes on Costa Mesa Mall. She moved to Oregon and obtained her Bachelor of Science in Human Services. She's worked with vulnerable populations for about 10 years. After 7 years in Oregon, she and her family moved to Arkansas in 2018. Michelle serves her community by working for the Arkansas Coalition of Marshallese as the policy advocate and communications specialist. Welcome, Michelle.
Yawale Osi.
Yahweh.
I feel like saying woo woo. Welcome, welcome. Next we have Ruby Lewis, who is crazy amazing. Ruby Lewis is a public health nurse for Arkansas Department of Health, the Northwest region. She was born and raised in Majuro. Did I say that right, Melissa? Melissa gonna correct me. Marshall Islands. Ruby has worked and continues working toward the COVID-19 effort, including case investigation, contact tracing, education, screening, and vaccination. Apart from COVID-19 effort, Ruby also manages tuberculosis and Hansen's disease cases in an outreach setting. Ruby loves working as an outreach PHN and feels she is where she needs to be in her career. Her hope is to continue building relationships with Pacific Islander communities all over the country and be as resourceful as she can be for them. Welcome, Ruby.
Thank you for having me.
And last but not least, we have the HBIC, the head boss in charge, Melissa Leylon. Melissa, native of the Marshall Islands, born and raised in the capital city of Majuro. And as soon as I get done with the bio, she's going to let us know whether Naki and I passed our language test. At age 17, she decided to leave the islands to enlist in the United States Armed Forces. Her career in the Army required her to travel globally, which gave her firsthand exposure to other cultures. It was then that she found her interest in working with people from different walks of lives. After 10 years of serving in the armed forces, she ended her enlistment to attend the University of Arkansas. Shortly after her move to Arkansas, she discovered the need to have an interpreter in the court system. After 2 years pursuing her interpreter's license, Melissa became the first certified interpreter in the nation in 2013. Subsequently, she was appointed by former Governor Mike Beebe to serve on the Arkansas Minority Health Commission. Her official appointment makes her the first Marshall Islander to serve on a state agency capacity. She was reappointed by Governor Asa Hutchinson. She is a recipient of 40 and Under 40 Award by Northwest Arkansas Business Journal in 2014. Leylon, as we said, is the founder of Arkansas Coalition of Marshallese, ACOM, a not-for-profit organization that is a Marshallese-operated organization and focuses on health, leadership, education, and culture. She is now the chief executive director for the organization. Her daily work put her in the middle of social services and policy advocacy, especially around Marshallese issues. Her leadership led to recent changes in state laws. In 2018, Governor Asa Hutchinson signed a resolution that allows Marshallese children to have access to the state Medicaid program. Her latest policy work has led to the passing of Bill HB 1488 and HB 1789. Both bills give Marshallese mothers and children protection against human trafficking and adoption schemes. She continuously serves her community by bringing in unique programs to the community that are impactful at a large scale and leading to social changes. Her relentless advocacy work has led to victory in a 25-year battle in restoring the COFA Medicaid, extending the Medicaid program to over 56,000 COFA migrants living in the United States. Leilani is married and a proud mother. She is currently living in Springdale. In her free time, she enjoys spending time with her family. Welcome, Melissa.
Never.
Well, Naki, I
Yes.
see you gave me the easy bio. Actually, let's ask Melissa right away. How do we do with the pronunciation of not just the Majuro, if we've got that right, but also the pronunciation of the governors? I think I messed that up.
Well, we'll talk about the governor later.
I know.
But
It's the
but
same governor.
you,
Yes.
you did amazing on the Medjero pronunciation. So good job. I say 10 out of 10.
We're off to a running start. That's what I love about our shows, and that's why I was so excited to go through just a rough Monday, just a bunch of normal Monday stuff, but all piled up. And I'm so happy to be here with everybody and sharing space and talking about the success of the program there in Arkansas. So I think since all three people are from the same organization, we're going to just ask, what would your coworker be surprised to know about you? So share something that your coworker might not know about you. So, like, Naki might not know that. Let's see. What might not she might not know that I did Brazilian jiu-jitsu when I was in Hawaii. I'm not sure if she knows that or not. Did you know that, Naki?
I did not know that. I
Oh,
did
good.
not know that.
Good. So there's an app that's modeling what that would look like. So let's start with Michelle. What is something that Melissa or Ruby may be surprised to know about you?
Oh my gosh. They don't really know me, so I think everything. I think the one thing that I could say for sure is that they didn't know that I wanted to be a lawyer because I can argue my way out of anything, but now I'm just like I don't like confrontation, so um, I'll just compromise.
Hmm. That's a tough job to have if you don't like
Confrontation. Yeah.
yeah, confrontation. That can be a tough one to have unless you're like a contract lawyer or somebody that you don't end up seeing people face to face. But that probably wasn't the type of attorney that you were thinking about.
Yeah, no.
Okay.
If I want it my way, then I'm gonna have it my way, but that's only at home.
Yeah.
Well, thank you, Michelle. How about you, Ruby? What would be something that Melissa and Michelle would be surprised to know about you?
Oh, I don't know. The same as is, we're all still learning, getting to know, and so really don't know the that. I would say that Melissa called in um, a runner in 3 years.
Okay. I think Mena will probably be working with you. The audio's it was a little tweaked, but Melissa,
Right.
yeah, we'll come back to you, Ruby. Melissa, being the boss lady, people in your organization might know a lot about you, but what would they be surprised to know about you?
Oh gosh, I think they don't know that I'm super funny.
We
No,
do.
you are
Um,
super funny.
We do.
I think everyone always see me in this very serious perspective, That is almost very unreal to see the funniness side of me. But I live. I like to see myself as very youthful.
Yeah.
Yeah, I have a youthful spirit.
Yeah, I think
Yeah.
what I didn't know about you was that your tireless walking pace. We saw that in New Orleans. Uh, it was crazy hot, and Naki and I were like ready to just go camp out. Like Naki and I literally stopped in one of these stores just because there was air conditioning. Like we walked by it, and we could feel the air conditioning coming out. I don't even know if she wanted to shop. We just went inside because it was cool, and everybody else kept walking. We were such babies with the whole walking thing, and you were a trooper. We kept looking at you like, how's she like? It felt like you're gonna start running there in a minute.
Yeah.
Well,
Yeah.
and I'm also a veteran, so I think whenever I'm in
Yeah.
those situations, that kicks in automatically. I get that.
Yeah. Wait. Yeah, you are very funny. We were busting up a few times during our meetings. We can't talk about here, but
Yeah, we'll
busting
leave that there. What happens in New Orleans stays in New Orleans.
That's
Um,
right.
but
yeah,
what happens in Arkansas with ACOM does not stay there because we're here to talk about the success that you've
exactly.
had. And
Yeah.
I think one of the things that we learned through COVID is how important the trust of the CBOs is in terms of being engaged in the safety protocols. We
Mhm.
saw it with testing, we saw it, and we're seeing it with the vaccine. It really speaks to, you could see where the community trusted CBOs, and a lot of it's coming out in the vaccination rate. You know, the number of people who are getting vaccinated, and the engagement. And we've seen great things out of Arkansas, and I think that that just speaks a lot to the ability of ACOM and the trust that the community has. So maybe we'll start with Michelle and talk about, from your standpoint, how do you think you got there as an organization to that level of trust with the community?
I think with Melissa's great advocacy and just her knowledge of people and the tribal leaders and her willingness to fight for our people and my teammates, they did most of the footwork, and partnering with organizations like Arkansas Department of Health and Community Clinic, UAMS, um, now Children's Hospital. I think all of that has come into play, and I'm just really grateful that the community really was open into um, listening to the message and hearing the stories that needed to be shared.
Yeah, I think that goes a long ways. Having open communication between an organization, so an organization isn't just a bunch of letters that people see on flyers or something. It's boots on the ground. You're there face to face, talking to people, having different events, and people can put faces with the name. Um, Melissa, you know you're the leader of it, and I remember before, when we were just in part of the response team, we had never met you, but we had already heard the great things that were going on in Arkansas, and the adversity that the Micronesian that the community faced. um, that was, there were numbers coming out of Arkansas where at some points I was looking at it going, is that a typo? Like, how can it be that, that challenging? Um, do you feel like you had already built that trust with the community before COVID, or do you feel like COVID helped enhance it? But kind of walk through where,
Yeah.
again, how do you get
Yeah.
to where you're at, where you have the trust?
Yeah, I think what we need to bring up is because it's a very different culture, right? And I think this goes the same with any Pacific Islander culture, where the trust is really the foundation of the work. So, um, looking back at ACOM in 2015, people were still confused what the organization stood for. And nonprofit running nonprofit is very rare in this, just the any Marshallese community in the world. That's, so people didn't understand that. So it was our job. Someone who was at that time was the president. It was really my job, and Sandy Airline and other board members, Pastor Billy and Patrick Boaz. I remember those days. It's like, you know, I'm
Yeah.
going back and having that connection again back to those days. But it was our role and our job to ensure that we safeguard this organization by continuing to build the trust of the community, because, you know, we realize it doesn't matter how much money you bring in, but if you lose that connection to your people, um, the work is nothing. So we wanted to make sure that there was one thing that the organization stood for. So from the very, I would say at the very start of the organization, it was a little bumpy road.
Mm.
But when we really remember in our culture, you don't become an adult until you're, in your late 30s, sometime late 40s.
Yeah.
So I just came out the military, went to school, came out of U of A, and I had to build something that was never there, never existed. So really, we were pioneers.
Yeah.
Um, and not just me, but also want to give credit to the other board members who were there since day one. We
Yeah.
had experience, I call storms in
Yeah.
building this establishment, but it's really part of the work. You really should expect that there are going to be frictions, or people doubting you, and
Oh, yeah.
rightfully so. You just need to prove who you are. So I was very young, in the Marshallese eyes. I was very young and a woman as well, and people just didn't connect to that. But we worked really, really hard for that, and slowly people start realizing that our services were meaningful to the community, um, and I think that that's really the key is being able to connect to the people. Whenever we establish or running a program, we want to make sure that it does have an impact, a positive impact on the community, like the driver's license class, financial education, these
Oh,
things that we know. I always know that if you're doing something now, you're changing 7 generations down. Um, so yeah, just little steps.
that's awesome. How are you finding that the community has trusted you more and more accepting since COVID-19 because they had nowhere else to turn but to ACOM?
Well, I think what people don't realize that we had actually experienced a similar situation with the mumps outbreak.
Right.
This was, Ruby might know, remember the date. I think it was like in 2000, I want to 2016, 17.
Yes.
There was a huge mumps outbreak
Mm.
here it started in our community.
Wow.
So even, prior to COVID, we were already equipped. We were equipped with the tool and with the skills that we learned. You know, is a very, very powerful thing to have support from folks from the Arkansas Department of Health, give you the resources that we needed during the mumps outbreak. So in a way, we were kind of already ready, but and then that's when we built into what we already have, programs that we already have. For example, we now with COVID, we started having our own and helping families paying their rent,
Yeah.
paying their bills, and then we started a food pantry. So you know, I think people couldn't, if without without the support and resources, I always wonder what would have happened if,
Yeah,
if we didn't have these sort of resources. What would our people be?
right, right. And Ruby, you're in the medical field. Were you seeing a lot of our community come in there, and is the numbers getting less of the people that are in the hospital?
Yes, the numbers are. Can you guys hear me well?
Yeah.
Okay. Um, the numbers are definitely they've went down a lot since the beginning of the pandemic. We we've just in the last week we're seeing spikes in numbers, and
Mm.
so that's concerning. But overall, hospital admission, COVID cases are going down.
That's awesome. That's good news, right? Because Arkansas had one of the highest numbers for our Pacific Islander community. So to hear that is really good. Um, Michelle, how are we doing? What are you guys that are ACOM doing to trying to get people vaccinated?
Oh, I think we're doing a lot more than Melissa says we're handling. So we're partnering with UMS and other organizations to spread the word and make appointments. Just letting the community know that there are drive-through vaccinations that they can go to. That community clinic, you can just walk in or schedule an appointment with community clinic, and then community pharmacy. They're also giving out vaccinations, and then now other pharmacies like Walgreens and CVS. Just letting the community know where to go get those vaccines, the resources, and that they have questions about it, they can always call and ask, and we'll try and figure out the answer for them. I think the biggest one was where can they get the vaccine from and transportation. And
Right.
so providing that information was critical to having people get the vaccine.
And are you seeing a lot of young kids, parents bringing their 12 years and older? Are you seeing parents bringing their kids in now? Like before, we were concentrating on trying to keep our elders safe, and now that it's open to 12-year-olds and up, are you seeing the parents coming in with their kids getting vaccinated?
I want to say yes, because I've also brought in my kids to get vaccinated because that's what they wanted. They wanted to go see their friends again. They missed them. They wanted to go be safe, but also hang around with their friends. And that was a good incentive for them to get the vaccine, but also have the elders in the community feel safe and comfortable with other people around.
And are the schools open up there?
Yes. Well, it's summer, but yes.
Yeah. Yeah. Oh, wow. That's
Yeah,
awesome.
I think I think it's even more important to look into like different ways to look at how you examine the needs of the community. One of them is transportation, lack of transportation. So what we do is we partner up with the Arkansas Department of Health, and we work with them where we make referrals to them where they can visit those clients and go to their home and give them those shots. So though, I mean, I feel like that's been effective, and Ruby's really has been like the nurse that we bother all the time. Like, Ruby, we have families for
No,
you.
really, they've been so helpful. The ACOM is like a one-stop shop for the community, so they get a lot of newcomers, even people from other states coming to them for their services. One one that's really been effective lately is the services that they do to get the I-94.
Mhm.
And so a lot of people go to them for that. And so ACOM has made it a requirement for if you were to go on the trip to get a new I-94, you would have to get vaccinated. And so that's
Mm.
when they refer them to me. And that's been working wealth for all of us with,
Yeah,
just
that I-94 is so important. Like if you don't have that I-94 form, which a lot of people don't have it, they
Right.
either misplace it or it's not in the system anymore. They have to get it replaced. So if you don't have it, you cannot get a job. You cannot do anything. So one of the, we offer free rides to the border where they can get that I-94 replaced. It's a 12-hour ride, by the way,
Wow.
one way, and we
Wow.
do that. We do that every. We were doing that like back to back for 4 weeks, back to back.
Wow.
Every Friday we take people there. So we realized that that was one way for us to make sure that ensure that more people get
Yeah.
vaccinated is requiring people to receive their vaccine, and then they can take the ride for free if they
Wow.
got if they receive their vaccination. So that's one way. Hmm.
That's awesome. That's awesome. That takes a heavy load off of them, to think, how
Hmm.
am I going to get there? What am I going to do? That's wow. Kudos to you
Yeah.
guys.
Another way is to really like designate a time where ACOM and Arkansas Department of Health or UAMS, whoever the partner is at that time, where we can concentrate on this population,
Mhm.
and we'll do something fun, like barbecue, and we'll open the pantry that day. So they go to the food pantry, and then the food pantry will say, "Well, you receive your vaccination, and we'll give you a free barbecue plate."
Oh, nice.
So they'll come over here and they go back and get their barbecue. It's almost like it's never a single item package. It's like a entire package. Yeah.
That's so awesome.
That's
That's
funny.
I love that.
The food is a it just it is it's a piece of the culture, right? Like we break
Right.
bread, you can have an hour meeting and there's going to be a lunch. Like there's
Yeah.
we're going to have food. Um, do you think there are things like right now? What are the things like that you feel like ACOM is really focusing on, like priorities? As it's obviously the vaccination effort, but are there aspects of it right now that you feel like this we can tweak a little bit, or we can reach a little bit further in the vaccination effort? Like I don't know, demographics or the rural population, or where do you prioritize your efforts right now? We'll start with Melissa this time.
I think our priority really should be with the youth right now.
Mhm.
There's been a lot of misinformation that are circulating out there, particularly after the Johnson and Johnson news about them
Yeah.
kind of put a hold onto that and stuff like that. So we want to make sure that we focus on this. I mean, I hope that we focus on the youths as well, because we still have so many that have not received their vaccine. So one way to do that is you know really looking at influencers, right? That the youths can relate to. One of them, we have, hopefully, we have it all right by Stroll the Atolls event. But we have an influencer who's coming in, and we're going to try to see if we can, use that platform to have her to motivate youths to come in and receive their vaccine. But we're also hosting Stroll the Atolls.
I
That's
see.
going to be July 31st. That's going to be a vaccine site, and we're expecting a lot of people.
That's
um,
awesome.
so, hmm
And what's going to take place that day?
Oh, on that day, and that's what I mean by you have to look at things and like, okay, I got to be creative, right? And I think that day is going to be education on our culture as well as the history. And there are going to be booths all throughout the event, and dances and performance. And atolls different islands will set up their own booth and provide education about what they're good at, or whether it's a product, whether it's handicrafts or food or whatever the case will be. They have the freedom to show and express who they are. And so far, I think we have over almost 100 shares on our Facebook. And that just we just posted that on Friday.
Wow.
So we have a feeling that we're probably going to get to maybe 3,000. I hope. I think maybe I'm a little overestimating it, but utilizing what you're really good at,
Yeah.
and where you can uplift the effort that you're doing
Right.
on vaccines.
And I think it's going to be a huge success because we've been locked up for so long, and everybody has been waiting for an event to go to, and just to be around, our own community. So I think it's going to be a huge success. Everybody's just waiting to see each other, looking for an
Yeah,
excuse to get together, right? And this is a great event to do it.
It does
yeah.
seem
I
like
think
the. Oh, go ahead.
yeah.
Go ahead, Melissa.
The board, Ruby is it's actually a very powerful voice on that board, and I think they really want to make sure that we do the stroll the atolls this year.
I think that that is a big piece that we missed in 2020 as a community is we gather for any reason, right? We look for a reason to gather.
True.
We were very social, and then that became the very thing. One of the major things that was called out: don't gather, don't do those things. So
Mhm.
I think as we get through 2021, of which we're already over halfway through, it's crazy.
Right.
That those are going to be pieces of our culture and pieces of our
Mhm.
community that are added back in. Um, I'll turn to Michelle from your standpoint as a policy advocate. Are there things that you would like to see or that you're working on in terms of reaching the youth? That really seems to be the big push right now. Are there any things that either you think you need or that you would have liked to have seen in place before in terms of reaching the youth?
Um, I think just for them to feel like they can trust adults again and feel like they're a part of the community and feel inspired and empowered to do what they can as they are a part of our community and they're going to be the ones stepping up hopefully after we take our place in the dirt, right? And so I'm just hoping they're willing to be the advocates for us and the advocates for themselves.
That's a really good point, right? That's our future. Those are the ones that are going to take it forward. Ruby, from your standpoint, working in the medical industry, seeing actually seeing and treating people, are there things that you think that are being successful in reaching the youth in terms of vaccination, or things that you'd like to see done more of?
I would say just education, just um, give a lot of education to them, making them understand because they're very they're misinformed about stuff that they read online, their friends or family members, and so I I find that educating them, telling them more about, making them understand about what is a side effect and what is a an allergic reaction, just making them understand the vaccinations and what to expect. I found that it's been working as far as getting them get vaccinated,
Yeah.
uh, and it's not just for that um, for younger generation, but with adult as well. Just providing a lot of education about the vaccines and how it's effective in helping them preventing COVID-19.
Yeah, education seems to be that's the great divider, right? Like you get into the education field and it's the what does it call it, the tide that raises all boats, right? The more educated we become as a people, the further we're going to get. So maybe at this point, I don't know if we want to. We have a video that we need to show, and I'm not positive when exactly that was on the agenda. That's the good thing about having your own show, right? You can just say, "Hey, we're going to do whatever, whatever, whenever we want." Um,
You guys
so
sound like ACOM.
it's about results, right? How we get there is one thing, but it's about getting results.
Yes.
Um, so is now a good time? I guess now it would be as good a time as any. It's a video that talks about how word travels in the Pacific Islander community. So I'll turn it over to our producer and we can take a look at Kavika.
19 vaccine. That's because friends and family know that vaccines prevent nearly 100% of hospitalizations and deaths from COVID. We can do this. Today, Kavika got his COVID-19 vaccine. That's because everyone 12 and older is now eligible for a vaccine. Kavika then found a vaccine location for his sister. His sister sent an appointment link to her best friend, who reminded her business partner, who then, well, you get the idea. And it all started today with Kovika. Tomorrow, it can start with you. It's time to let our friends and family know that vaccines prevent nearly 100% of hospitalizations and deaths from COVID. We can do this.
With We Can Do This, a campaign run by the U.S. Department of Health and Human Services. For more information, please go to www.vaccine.gov. Naki, go ahead.
Awesome. Hey, you go, Kavika. Have you been finding it like that? It's literally word of mouth, because I know here with the vaccine, it's, I'm telling my mom, who's telling the pastor in our church, who's really word of mouth in our community. Are you finding that there in Arkansas that it really is word of mouth?
Yeah, I think so. There is a word for it. Coconut wire network.
Yes. Yes. That really is true. And so we're going with Kavika with the tell somebody and tell your family and tell your friends, and that it's totally not a cure, but we always say this every week, that it's a layer of protection so that you don't get the severe symptoms and pass away from them. So it's really 100% will help you try to survive COVID. So
I always liken it to the seatbelt, right? Like maybe that helps you if you get in a wreck. You don't plan to get in a wreck, but
right.
if you do get in a wreck, it's probably going to help you if you got your seatbelt on. Might save your life.
Yeah.
But I can't listen to things on the internet and things that I read. I just got to deal with common sense.
I know. And that's another thing I was going to ask is, are you having to battle what people see on social media compared to like real life medical, data? And did you have a lot of that going through the pandemic and trying to get everyone vaccinated, Michelle?
Yeah. Yeah. You're spot on everything. And when COVID first hit here in Arkansas, we were prepared for it. We knew our community needed to hear, the reasoning behind it, and the data, and just, and when everybody got sick, and then we lost so many people in our community. Sorry, it always hits home. I
Yeah.
get really teary. Um, it's always around this, not always around this, but we gather for a reason, but gathering for a funeral is hard. It's tough. But especially for this month, since that was when it really hit our community, we were just like, we've got to do more. We've got to tell our people we're losing too many of you guys, and it's really important for us to keep each other safe.
Yeah, I think a lot of times the reason that we want to do something is actually the reason we shouldn't. So exactly
Mm.
what you're saying is the reason I want to gather is I want to show my love, I want to show my spirituality, I want to show support from my family or my friends, and those are the actual reasons that maybe you shouldn't do those kind of things just for those exact reasons to keep your friends and your family safe. But I think it's more difficult for um, a culture that celebrates, that looks for reasons to celebrate, look for reason to gather. Um, that's unfortunately that was one of the things that some groups didn't have to battle so much from a systemic or just a cultural standpoint.
Right.
Yet you know we were the ones that if we got it, we were more likely to have serious complications than other groups, and we had extra layers of things like multi-generational homes and lack of maybe language or any of those kind of things, access to healthcare, all those things just multiply, um, and it would make us want to gather, right? Because it's a more stressful time than ever. Well, then I'd like to be with my family and my loved ones to seek comfort for that. So I think it's been a really compounded issue with Pacific Islanders that a lot of people wouldn't understand. Like they wouldn't understand. Like, well, just don't go to the funeral. Well, do you might not even understand what you're saying to a Pacific Islander to say, well, I just won't go. Like, well, why is it a big deal? I'll just skip it. Um, are there areas that um, so, like in California, most of the Pacific Islanders, you're going to find them in urban areas. You're going to find them in, the Bay Area, San Francisco, San Mateo, Alameda. In urban areas, densely populated areas. Are there rural areas in Arkansas that you've had to seek out to get communication to or get information to? And here's something that I learned in a PI show: always call a name, otherwise everybody's going to be polite and nobody's going to talk. So I won't throw that out to everybody. I'll start with Ruby. Do you see that in your field that there are we're mainly concentrated in the city, or are there rural populations that we need to get to?
There were there are some rural communities. I believe is it Berry. They're on the northeast side of Arkansas and some in the central north. And so the areas that are they don't have um, a lot of resources or yeah, they don't have a lot of resources that we do over here on the northeast, northwest side of Arkansas. Um, so there were some times we had to, our team would have to drive all the way down there to, you know, looking for people that were trying to locate. We also did some testing um, clinics out there in those areas. Um, there were also some areas in the southwest part of Arkansas that were very hard to reach. Um, and so we had to communicate with other counties in that areas, either with translating over the phone or video communications with them. Yeah.
Appreciate that, Ruby. Michelle, from your standpoint, do you see as a policy advocate, are those things that you're concerned about? Maybe not specifically with COVID, but in your advocacy for policy and regulation and those kind of things, are the rural population something that you focus on?
Yeah, because we do have Micronesians who live out there in rural areas, just because we love, countryside.
Yeah.
Islands just remind us here in countryside, it reminds us of the islands. And so being around just green scenery and nature is what we love. And so we do have folks who call from D Queen or Pocahontas or Berryville, in other places in Arkansas, that not just Arkansas, also in Oklahoma, and we try to provide the resources that are closest to them. But yeah, we do.
And I think it's even more critical for us to look into the rural areas. Here in Arkansas, we have so many resources available for the Marshallese community. It seems the concentration is in Northwest Arkansas. So a lot of, if you talk about government agencies, they're aware of the Marshallese here, but not in those rural areas. And we did we actually did clinics in those areas, the rural areas, and we work with Dr. Rickling and other healthcare providers in that area there. We went over there northeast a couple of times, um, and they were very unsuccessful in reaching the community until the group that we were in went and started knocking on doors and things like that. So immediately the community came out. Yeah.
That's awesome. Is it because of the mumps that the Arkansas community, or our community, that the state and the county see us there? Did you have to get the numbers disaggregated because of the mumps, or was it always that way?
I think there has been a lot of effort leading to data disaggregation. And I think I think that was one of the first wake up callers was the mumps, because it seems it was focused. The mumps was especially around the Marshallese community. And I think that was one of and Ruby might know more, and Sandy, who's also one of our board members, she's also a nurse, and Ruby replaced her later on. But I think that was one of the first wake up callers was that.
Yeah.
And I want to say that there has been like resources like where Ruby works with the Arkansas Department of Health. They have like certain programs that are designated for Marshallese, like the Joe Bates Clinic. It was actually built. They built it to address. Uh, um, I'm not going to mention diseases, what kind of diseases, but certain illnesses that this community was impacted by. So I remember when CDC gave the money to Arkansas Department of Health to build Joe Bates Clinic. That was because certain illnesses that the Marshallese were prone to be infected by. So I believe because of those sort of things, it seems maybe made it easier for the state and the county. The county just disaggregated their data, and I think a lot of people don't look at the bigger picture, right? Like the
Right.
Marshall Islands were used as nuclear testing sites,
Right.
and I think because of that, that sort of gave the Marshallese this leg up to have this friendship
Right.
with the United States, and I think maybe there's some remorse in providing some of these resources. They might not as big as they should,
Yeah.
not because I mean I think if you nuke somebody, I mean you
I
owe to them.
Hello. Yes.
Hello.
Right.
Yeah.
You're
So.
absolutely right.
Mm-hmm.
So and that probably was a wake up call. Like you just mentioned that, our community in Arkansas or anywhere really, you mention the Marshall Islands, you would think there's no hesitation in giving us what we need. But as sad as it is, sometimes we really do have to fight to be seen.
Oh, definitely. I mean, I'm looking back, maybe 5, 6 years ago, the community was completely unseen.
Yeah.
Um, it's changing. People are realizing that there are Marshall Islanders and Kufa citizen living in Northwest Arkansas. And the way the funders are thinking is little different
Yes.
from the way they used to 6 years ago.
That's really a tribute to you and the to the
Yeah.
organization overall, especially when you think about what you had talked about earlier about, initially you weren't received, the way that someone would like to be received when you're trying to help people, right? Like there were things that you needed to overcome, not just organizationally, but from a culture standpoint. Has that is talk about that? Is that it should be? I would think it is, but is it really satisfying to see um, the progression to where 5 6 years ago there wasn't really a voice or there wasn't really a platform to stand on and speak from? Is that do you see the difference in the change, or you just kind of got your head down and you're working? So do you see the I don't know, the bigger picture in what you've been able to accomplish so far?
That's one of my weaknesses. And
Mm.
Michelle and Ruby can probably vouch me on this one, but I'm so weak when it comes to realizing your accomplishment. It's never about uh, individual accomplishment. I think it's you always look at what have you done to change the way the entire community think, or adjust things, and has that been helpful? To me, maybe it is. To other people, they might look at like, look at where you came from, but we don't. Sometimes we don't see that because we're so tuned into the work that we're doing, and it never stops. Like,
Yeah.
there's always someone coming into the office, needing help on eviction notices.
Right.
So it's in our nature to think like, okay, what am I doing that's not changing things? So I
Hmm.
think there has been big um, movement, and a lot of changes has happened. I mean, people, Marshallese are now owning homes.
Yeah.
Or it's so different from 6 years ago. Yes, I like to say yes, but I'm just horrible at saying, "Oh, you've done this." We always, because we're so invested into the work that we do every day, that we
Right.
never, like, they'll send us champagne. Our funder will send us champagne and say, "Congratulations on Medicaid, coupon Medicaid restoration. Your congressman just signed the bill or whatever." So everyone else would have just like stop and drink their champagne, but we won't.
Right.
We just
We,
keep
we
going.
don't got time.
Right.
We
Hmm.
don't got time. There's more.
Hmm.
There's always something next.
I
The
think
evictions, the resources. Like you have to drive people 12 hours. We don't got time for that. But you have to recognize the lives that you're saving, right? The people that you're inspiring with the work that you're doing there in Arkansas. You got to just take 30 seconds to recognize, the people that you're helping.
Well, my staff promised me that if they call me and I'm in a meeting, they'll have to put $1 in a little jar, and by the end of the day, we'll find out how much money is in that jar.
Oh my gosh.
That
So
jar's gonna be full.
what is next? What is next? Is it just that trying to organize ATOL? What is next on your list? We'll start with Michelle.
Everything from youth to policy, um, and continue with insurance enrollment, Medicaid enrollment, just getting our folks educated and vaccinated.
Right, right. I think we're all concentrating on that. Ruby, thank you, Michelle.
Yeah, just continue advocating for vaccination and just, buckle up and see what's next.
Yeah, because there's always something next, right?
School is about to open up, and like I said, the numbers are just recently spiked up last week. And so we're um, just getting prepared for what's next.
And is it a requirement there for the kids to be vaccinated before they return to school? Do you know?
It hasn't been required yet.
Okay. But the mask and the 6 feet is still in place.
All the precautions, yes.
Awesome. Thank you, Ruby. Melissa, well, what's next on your list, girl?
Oh my goodness. I think right now the immediate thing on our list is stroll the atolls, but
Yeah,
also stroll the atolls like addresses things like COVID vaccination because it's going to be there,
yeah.
education, and we have providers, healthcare providers who are going to be there to educate the community about COVID and stuff like that. So
Awesome.
I'll say
Thank
this before we go. I think that Melissa, your response of are you able to see all the things that you've accomplished, or is your head just down working and doing the work? And I think that your response that it's hard for you to celebrate things because you're so like what's next. I think that's why you were able to win over the community, and you were able to break down some of those barriers because you are humble, because that's how you conduct yourself, and that's how your organization conducts themselves, and that's why you have the trust of the community and you're able to do the work that you're doing. And I
Mhm.
think that your answer spoke volumes as to why ACOM's successful is because you're not, out there breaking your arm, patting yourself on the back kind of thing. That
Yeah.
that happens a lot. It happens a lot with organizations as they grow and they start doing things. They really kind of lose sight of like why they started. So, congratulations to ACOM. There's a lot of organizations around the country that look at like what does right look like. Well, what's going on in Arkansas with ACOM is what right looks like. Like that's how you get the trust of
oh,
your community, and when you have the trust of the community, you can move mountains, you can do things. With no trust, it just it doesn't happen. And to get the services and all of the things that I always say this: the only thing that can save us is us, right?
mm,
There's government programs, there's money out there, there's all these kind of things, but unless there's groups like ACOM out there doing the work, to administer those kind of things, it's really hard to get anything done um, in the Pacific Islander community. So congratulations to you and ACOM.
Thank you so much for joining us this evening. We appreciate your time. We're going to give you back to your family. Melissa, thank you for letting us take your girls for an hour. Ruby and Michelle and Melissa, thank you so much for the work that you're doing there. Again, go to their website, follow them on Instagram, get more information at www.arkansascoalitionofmarshallese.org. Thank you, ladies. We're here every Monday at 5 p.m. We have a special edition after this at 6:30. We'll be talking to Dr. Samoa about everything crazy and the survey that he did last month. Thank you so much, ladies.
And don't
Thank
go anywhere.
you for having us.